From United Nations Television, this is UN in Action.
Walungu village is near Bukavu, the capital of South Kivu province in the Eastern Democratic Republic of the Congo. Many of the women waiting at this hospital are victims of sexual violence, but only some will look beyond medical care and seek justice. Sexual violence is a hallmark of the conflict in Eastern Congo. Justice for most of the women has been elusive. Walungu Hospital is the main public hospital in South Kivu. Understaffed and under-equipped, with a capacity of only 160 beds, it services a local community of over 20,000 people. Jean Mukingeka is medical director at the hospital.
Not all women victims of sexual violence seek help, out of shame or fear of stigmatization. But we are seeing more women come to seek treatment.
The United Nations is finding ways to protect women and children from rape and other forms of sexual violence. This includes appointing women as protection officers. Luc Heckenbrandt is from the UN Human Rights Office in Congo.
We are trying to support them through a network of local NGOs to provide kind of assistance to these victims.
The government has begun holding public hearings to explain its zero-tolerance policy towards sexual violence by the National Army and other security forces, which have been implicated in large-scale pillage and killings, crimes committed against the very citizens they're supposed to protect. Local organizations are working with the United Nations Human Rights Office to help victims of rape seek justice. FADER operates in Walungu. Prosecutions are difficult and rare, but these women waiting at FADER's office want to see the perpetrators brought to justice. Ntizala Chamoka is one of them. Her home was raided by people seeking to get back an unpaid loan. They took away her farm produce. Ntizala sought assistance from the National Intelligence Agency, ANR, but she didn't find help there. An ANR officer sexually assaulted her.
I went to his office to seek help, but instead of listening to me, he raped me and gave me this illness. The illness is AIDS.
With the help of FADER, Ntizala reported the case to the authorities. Domitien Nakalonge is the director of FADER.
We follow up victims of rape and accompany them to the police to get justice, and we take them to the hospital and follow up to ensure they get treatment, and also follow up in the prosecutor's office.
The local police acknowledge the high number of rape cases against women, but they say they don't have the capacity to respond effectively. The only transport at the police station in Walungu is used by the police commander, Willy Kibaya Lukangu.
When you are arresting someone and have to walk long distances, and there is only one policeman to man the criminal, they will run away.
Despite the terrible odds, the very real likelihood of sexual attack, poor health services, and the lack of access to justice, women in the Democratic Republic of the Congo are starting to resist the stigmatization of rape victims, and some are daring to challenge the culture of impunity. This report was produced by Christine Wamba for the United Nations.